The trach shown in this video can look different from the trach you have. The way that you care for your trach stays the same. What to expect with your trach. I refer to you throughout this video for the sake of not listing all the people involved in helping you with your trach. You includes you, your family, friends, and any other caregiver. This video will discuss things you can do to make talking, eating, bathing, oral hygiene, and sexual health easier and safer. Your voice is made when air flows through your voice box. Your trach and trach tube bypass your upper airway, your nose, mouth, and voice box, and now bring air right into your lower airway, windpipe, and lungs. You will not be able to talk for 3 to 5 days after your trach surgery. You cannot talk because the trach tube you wake up from makes it hard for air to flow through your voice box. This is because the trach tube has a cuff. The cuff is a part of the trach that sits inside your trachea. The cuff is like a balloon that can be inflated and deflated. A trach tube with its cuff inflated is first used as it helps air go directly into your lungs. It helps keep the trach tube in place and it prevents aspiration. It is this cuff that makes it hard for air to reach your vocal cords. If you were able to talk before your trach, you will be able to talk again. About 3 to 5 days after your surgery, and when your doctor thinks you are ready, your trach tube will likely be replaced with one that does not have a cuff. This cuffless trach tube will allow air to reach your voice box, allowing you to speak again. Your voice may not be as strong or as loud as it was before your trach surgery. Your doctor may refer you to a speech-language pathologist if you have problems speaking. Speech-language pathologists are trained to help people safely manage problems with speaking, eating, drinking, and swallowing. If it is safe to do so, you may be given a hands-free, one-way speaking valve. The speaking valve is placed over the inner cannula to help you talk. Your doctor and speech-language pathologist can help you with this. Speak with your healthcare team to find out if there are any other ways on how to speak safely with a trach. You should be able to eat and drink and swallow with your trach, but some people do have problems. If you have problems eating and drinking, your doctor can refer you to a speech-language pathologist. A speech-language pathologist may give you ideas about food and drinks that are easier to swallow. Over time, you may return to eating and drinking what you ate before surgery. If you have questions about eating, speak with your doctor or the speech-language pathologist. You should avoid getting water into your trach. Water can get into your lungs, making it harder to breathe. It can also make you feel like you are drowning. Water in your lungs can also give you an infection. It is important to keep water away from your trach opening. Here are some tips to help you bathe safely. Do not immerse your trach under water. Water can enter your lungs and you can drown. Use a handheld shower to control the spray of water. If you have a fixed shower head, turn your back in the shower to keep water out of your trach. Take baths instead of showers. This will help to keep water out of your trach. Wash your hair in a sink. It is important that you have good oral hygiene. Perform the oral hygiene routine that was recommended by your healthcare team. Good oral hygiene may help to prevent infections. It is common for people living with a trach to have concerns or questions about how this will affect their sexual life. Airway secretions may make it harder to communicate and be intimate with your partner. It is important that you share your feelings and concerns with your partner. Talk to your healthcare provider about your concerns and to see what resources are available to you. You've now come to the end of this video on what to expect with your trach. In this video, you learned what to do to make it easier and safer to talk, eat, and bathe. Watch this video as often as you would like. It is important that you feel comfortable doing everyday activities with your trach.